The union that represents staff at the University of Victoria would like to hear from anyone who has spent any time working in the Sedgewick building on the UVIC campus, because you may have come into contact with mould. WorksafeBC recently inspected the aging building following concerns about the air quality inside. And CTV News has learned that report shows people have been complaining about health issues in the Sedgewick building for more than a decade now. CTV's Louise Hartland joins us now with more on that. Louise.
Hudson, mold is a common problem in older buildings such as the Sedgewick, and that is exactly what one union says is causing a number of health problems for people who have worked there.
You're putting people's lives at risk.
Words of anger and frustration directed at the University of Victoria after a WorksafeBC report found problems with the air quality in this building on campus.
My members are very disappointed about this. They're extremely disappointed because they've been exposed to hazards for the last 12 years.
CUPE Local 951 represents approximately 850 office employees, library assistants, technicians, and childcare workers at UVIC, many who have worked here in the Sedgewick building.
In each case, we have addressed the individual issues as they've been raised.
This is the WorkSafe report issued March 29th. It shows elevated levels 31 times higher than the recommended amount of 2 toxic molds were found here in December 2009.
What we did do to address that was to move forward with a project to seal the building crawl space, and subsequent to that to restart a ventilation system to provide more fresh air.
WorkSafe found air quality did improve after the university put those measures in place. The WorksafeBC report found in interviews conducted between January and April of this year, most workers reported their headaches and debilitating fatigue had improved since the ventilation system was turned back on, or since they left the job. But the report finds 6 of those workers still have symptoms, including chronic coughing, bronchitis, runny nose, itchy eyes, and asthma. The list goes on. And all of those workers say those symptoms disappear when they leave the building.
Individually, we've not found any real source of the problem, but now moving forward, we want to make a very comprehensive review of the entire building.
The WorkSafe report cites the university under the Workers' Compensation Act for failing to protect the health and safety of workers in the Sedgewick building over a 12-year period, including students, not fully investigating and providing testing for airborne contaminants, as well as failing to put an effective system in place to deal with complaints, and not submitting written detailed measures to WorksafeBC to correct the problems.
It's about working together and make sure that as partners we're able to ensure our workers are in a health and safety environment that's safe for all of us.
The union says more needs to be done before more people grow sick from what it says is a growing problem inside this aging building. CUPE Local 951 is asking anyone who worked in the C wing of the Sedgewick building between 1998 and 2012 to contact it. And like most unions in the province right now, Local 951 is in contract negotiations. A representative for the union tells CTV News it has not taken a strike vote as of yet and cannot discuss the timing of when the vote or a potential strike could take place. Hudson.
All right, Louise Hartland, thank you.
You're welcome.